They give life-saving care.
But are they taking some San Diego patients for a ride? In a joint investigation with ABC News, Team 10 exposes air ambulance companies accused of leaving the very people they save facing financial ruin.
How am I supposed to pay for this?
Team 10 investigator Adam Rakusin has been working on the story for nearly 2 months.
And you've been looking into for-profit emergency medevac companies accused of taking advantage of people at their most vulnerable moments.
Yeah, around 400,000 people are airlifted to hospitals by helicopter each year. Just from the promotion of this story, we're hearing from viewers. I got an email from one saying they got an air ambulance bill for $28,000. People aren't going to turn away the life-saving help, but that help comes at a price. It was spring of 2013 when Connie Ortiz heard a knock at her door.
My son looked really confused, like something had happened, something bad.
16-year-old Giovanni had been in an ATV accident.
He was like dazed out.
Connie rushed him to the fire station for help. No one knew the extent of Giovanni's injuries. And the closest trauma hospital more than an hour away. Crews dispatched an air ambulance like this.
You see them rushing him in there in the bed, and I started panicking.
The helicopter ambulance got Giovanni to doctors in about 15 minutes. He suffered a serious concussion and was pretty banged up, but survived. Then the real pain, a bill for $33,000 and change.
And I still didn't worry because I said, well, I have insurance. Insurance will cover it.
Their insurance, Medi-Cal, denied payment. The reason, the air ambulance was medically unnecessary. They would have to pay that $33,000 out of their own pockets.
That's double what you make in a year.
Yes.
Connie says she went round and round trying to lower the price, but a collection company still came calling.
I started getting nervous, like I said, about losing our home because that's where we live.
It's like shoplifting.
Attorney Allison Snow has handled several air ambulance cases in San Diego County.
When you get one of these bills for over $30,000, which a lot of times exceeds what a surgeon charges at the hospital for emergency services, it's pretty daunting and very shocking.
They're charging whatever they want for the service. They're collecting the reimbursement that the insurance carrier will provide them, and then they are balance billing their patients.
Balanced billing. Remember that. Al Redmer is the Maryland Insurance Commissioner. Maryland's been looking into complaints about air ambulance bills. Across the country, air ambulance companies fall under the federal law, which deregulated fares for the airline industry.
Because they're unregulated, they can send a bill for almost any amount that they want.
We're saving lives each and every day across this nation, just like at this base here.
Paul Webster is with Air Methods. They own and operate the company that flew Giovanni. Webster says they set the rates based on things like low reimbursements from Medicare and Medicaid, the cost of operating the helicopter base, and cost of always being on call. He dismisses accusations of price gouging.
We will discount sometimes up to 100% of the balance of their bill. And so I think it's an unfair characterization of how we collect balances owed by patients.
And yet, Team 10 found nearly half a dozen lawsuits filed by Mercy Air in San Diego County Court, including one where the bill was nearly $45,000. The family hired an attorney who was working with Team 10 for this investigation. We got Air Methods their bill and paperwork, and after an interview with the company, the case settled, meaning now we can't talk to the family.
And I didn't want them to come and get him.
Connie also settled her bill. It only took about 2 years. While relieved, the daunting debt that could have been still haunts her.
We need emergency services for like that. But it's also hard, like if people don't have insurance or if our insurance companies don't want to pay.
And sometimes the company charges patients more than the actual cost for a flight in order to make up for low government reimbursements. They admit if everyone paid their fair share, the average cost would be around $12,000. And as we mentioned with this, we worked with ABC News' Brian Ross on this team on a nationwide investigation. He'll have more on that tonight on World News.
Certainly seems like price gouging when you could rent a helicopter. I understand the ambulatory care, but still you could rent for much, much less than that. $33,000 is so much.
Yeah, it's a lot of money.
Yeah.
Astounding. Thank you, Adam.